butt hit the bed, so I'm gonna hit acquire. And let's wait and see if our EKG will smooth out. And just shallow, slow breathing. Good.
I'm sorry.
It's okay. No, breathe how you need to. You're doing fine. Her heart rate's coming down nicely. See, I know I'm swaying, but see how the shallow breathing, I'm still getting it in between views. And then turn more towards me. PVC there. So I want to hold a little bit longer if you're seeing those PVCs because we don't want ectopy for a post. You're good. You're doing great. She recovers quick. Okay, so I'm done. It's been a minute. You guys will have a minute and a half. Hit acquire. Okay, breathe however you need to, lay however you need to. All right, and then I don't even think our EKG was reading well, so we'll see what we get for heart rate for apicals because it was kind of chaotic. The nice thing when you're doing this in the hospital is they have a full-on 12 lead that's secured abrasively to their skin. So your EKG is normally much clearer than this. So I hit acquire, we have to go back to the protocol tab. You're gonna hit end capture. And then this will bring up everything that we acquired in that time from hitting the acquire button to stopping it. So I'm gonna page through here. Like, see, this is where it's tricky. We had poor EKG. I know her heart rate wasn't 90, but I can't pick that one. Here we got 169. In-post time is good, and I can almost see all the endocardium. So that's an option. Let's see if there's anything better here. We're looking to be above, what was it, 115 or at least, because you were in the 80s, mid 80s.
Like
I think that first one was the
100 and
best.
then 160.
Yeah, I think this one was the best. So I'm going to choose that one because see how I can see the endocardium coming in? Now sometimes when it doesn't capture well with your EKG too, it can trick your eye. So like, you might think something's not squeezing well, but it's just how it's shifting. So you have to be very careful and make sure that the heart's not swaying too much. So I like this one best. The heart rate makes sense. We can see endocardium. So there's my apical 4. Now I want my apical 2. Go down to these 2 chambers here. Got there eventually. There's 158, but see how that breathing is coming in? That's lung interference, so I don't want to use that. It's blocking my anterior wall. And we're at 218, which I highly doubt. Here we're getting clearer. 223, 217. These heart rates are probably not true based off of the EKG. You can kind of see there's artifact in there. It's capturing instead. 112, 134. This one's a little bit better and in the 130s. So I'll grab that as my 2 chamber. I'm under the time limit. My heart rate's above where we wanted it to be. Well, and they're even better here. See, this one has a little bit of right side. That one's kind of swaying actually, so we'll keep with the one we got there. So we'll go to our lung. It's fun getting to see yourself struggle through all the images, isn't it? Oh, I got it for a second there. There we got 130. I can see that posterior wall squeezing. Everything looks like it's coming in. Use your little pointer to look for that endocardium if you're questioning if it's moving or not. See, I can see it all coming up towards my cursor. So we'll grab that as our lung, and then we'll go down here. And here's when you started having all those PVCs. So our heart rates are gonna probably be all over the board because it'll average that PVC in with your regular. There we go, 124, 120, and I'm still in my time limit. So both of those are good. That one's probably got better endo. Now, I kind of don't like that 2 chamber. So if I wanted to edit, if I'm like, I want to pick one different, you'll hit edit stage, highlight that image, and hit unaccept loop. It stays here and this is black, so I have to come out of edit stage, and now it brings me back to my continuous capture. Now the hard part is this one's kind of swaying, but if I hold my cursor here, do I see that endocardium thickening? My heart rate's 109. And here we just got RV kind of peeking in, but I can see that endocardium. I'm gonna go with this one, even though it's swaying a little too. They both are. Adequate. It's not perfect, but we can see what we need to. They're pretty much in the same plane. Okay, so now I'm happy with my pictures. We'll hit accept stage. And then you can see side by side.
This is the moment we take a picture.
You can, yep. And so these are the in-post times that you'll want to grab. Sorry, we should have done that before we hit accept stage, so that you can grab these in-post times. But you guys can take it off this as well. It's just 2 different pictures instead of 1. Now the goal here is to try and be in the same plane for these. I can actually already tell. See how these kind of look different? I was in a lower window here. Because when they come off the treadmill with their breathing, a lot of times the higher windows are harder to obtain because there's more lung interference. So naturally you slide down a rib space. I don't have as much RV here, so I'm a little bit lower. I can still see what I need to, but you want to try and stay in that same spot if possible. But numbers are good. We're 30 above, right? And our times are all under the time limit. So this would probably pass. Sound good?
Mhm.
Okay, that's it.